Class number 2. Starting the new year off healthy was the video that we recorded last week. If you haven't watched it, I would encourage you to go back and watch it again. My name is Dr. Richard Huntoon from Advanced Alternative Medicine Center. I'm located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. This, like I said, is my second class, healthcare class of the new year. This class itself is specifically about the health of your kidneys. The kidneys are a paired organ. They sit just below your rib cage on your back, and they're the most important organ in your body. They're most important for several reasons. Probably most important reason for why they're most important, not to be redundant, is the fact that they help to balance and regulate your electrolytes, your sodium and your potassium, your chlorides, other minerals, etc., which the sodium and potassium primarily are responsible for maintaining and balancing your blood pressure. There's a lot of interrelationships associated with that, with the help of the adrenals that secrete a hormone called aldosterone. So when you're stressed, aldosterone gets secreted, causes the kidneys to retain sodium. With sodium, you retain water, and when you retain water, your blood pressure goes up. Now, the interesting thing is medicine talks about that very often, and they want to put you on blood pressure medication. If you are somebody that's been put on or recommended or has been on blood pressure medication for a little while or for a long while or for your whole adult life, etc., or they want you to be on blood pressure medication for your whole adult life, you're going to want to pay attention to the end of this video to where you're going to be able to be given my phone number so that you can call me and we can discuss how to get you off your blood pressure medication, how to get your blood pressure back to normal, and how not to set yourself up for other health issues once you start the blood pressure medication. So stay tuned for that information towards the end of the class. But regulating your blood pressure as a result of sodium and potassium through the kidneys with the help of the adrenals. What else do the kidneys do? The kidneys, they regulate your fluid levels and how much fluid you have in your body and how much fluid you don't. And when you don't get enough fluid, and when I say fluid, I'm talking about water. We'll talk about the amount of water that you need in a second. When you don't get enough water in your system, a couple of things are going to happen. You're going to become constipated. Why? Because you don't have enough water. So when the kidneys need more water, it actually influences the functioning of your large intestine, sucks the water out of your large intestine so that the kidneys can actually maintain their normal functioning. And if you take all the water out of your large intestine, then things dry up and then things don't move the way that they're supposed to, ultimately leading to constipation. So constipation is typically a symptom of not just a large intestine imbalance to where you're probably lacking probiotics, but also because you probably don't get enough water. Now let's talk about water for a minute. Last week we talked about the right amount of water that you need to have, because one of the 5 things I asked you to do was drink more water, drink the right amount of water for for the size of who you are as a person. Let's review that briefly. If you weigh 50 pounds, you need a quart of water every day. If you weigh 100 pounds, you need your 8-ounce glasses of water every day, or 64 ounces. If you weigh 150 pounds, you need 3/4 of a gallon of water, or 3 quarts of water every single day. And if you weigh 200 pounds, you're going to need a whole gallon of water every single day. And once you start doing that, as I mentioned last week, your metabolism will start to work more efficiently, you will burn your food more efficiently, and you will actually start to lose weight. So for those of you who need to lose weight, who have weight management issues, one of the best things you can do is make sure that you're drinking enough water. Now, what is water going to do for the kidneys? Water is going to keep the kidneys functioning properly. It's going to keep the fluids filtering through the kidneys at a regular rate. When your kidneys have the fluids flow through them, it pulls out the waste products, which gets excreted in the urine, okay? And it puts back or maintains whatever the body needs that's necessary. So when it comes to blood pressure, as I said earlier, sodium, which has been demified because sodium's bad for you, is what we've been told easily for the last 40 years. Sodium is necessary for normal cell function. When you take sodium out of the equation, your adrenals are going to secrete aldosterone, which is going to cause you to conserve whatever sodium that you have, and you're going to excrete excess amounts of potassium. Now, sodium and potassium work together. Sodium brings things into the cell, and potassium brings things out of the cell. So you got a two-way door going on there, regulated by sodium and potassium. And when you have not enough potassium, because people don't tend to eat foods that are high in potassium, what's eventually going to happen is you're going to have a sodium excess. And when you have a sodium excess, again, that causes your body to conserve water. And when you conserve water and sodium in an effort to maintain normal kidney function and adrenal function, your blood pressure is going to go up. But your body has something that medicine doesn't ever talk about. It has a protective mechanism that helps to bring things back to normal. It's a thing called aldosterone escape. And that's where the body will actually get rid of the excess aldosterone that causes you to retain sodium. And what it'll do is it'll allow the sodium levels to go back to normal. And the way that you can help to expedite that is to make sure that you have enough potassium in your diet. Okay, bananas, very good source of potassium. You could probably ask my wife, what do I have for breakfast every day? I have 2 eggs and I have a banana. So I start my day off making sure that I get enough potassium. But I also take lots of different supplements, and we'll talk about supplements later on in the year. But I do a lot of things proactively, and the purpose of this video is to make sure that you too are proactive. So getting back to the health of your kidneys, the kidneys are responsible for maintaining your blood pressure. The kidneys are responsible for maintaining proper hydration, but you got to drink water in order to do it. If you're drinking something other than water, well, Dr. Rick, I drink a lot of coffee. Dehydrates you. Well, I drink a lot of tea. Dehydrates you. Well, I drink a lot of juice. Dehydrates you. Well, I drink a lot of soda. Definitely dehydrates you. Okay, because your body actually has to lose water in an effort to digest those liquids that you're ingesting. In order to extract the water out of those liquids, your body actually has to lose water in order to do it. So if you're drinking these things other than water, you're actually creating dehydration. Now, when one gets admitted to a hospital, what's the first thing that they do for you? That's right, they hook you up to an IV, because they know just by you being in their facility that you are dehydrated. So the first thing they want to do is they want to give you fluids to bring you back up to normal hydration. Then they can start to figure out what may or may not be working properly and what they have to do in order to remedy that. But the first thing they want to do is hydrate you, because being properly hydrated is very, very important. So your kidneys regulate blood pressure. They also regulate fluid balance, but you have to add water in order to make it happen. Anybody that knows me and knows me well knows that the only thing that I drink is water. And it's room temperature. Why is it room temperature? Because when you drink water that's cold, it literally shuts your stomach off. So you go to a restaurant. What's the first thing they bring you when the waitress comes over to the table? She brings you a glass of water. Usually the water has ice in it. Not okay. Okay, so I ask the woman or the man, whoever the waiter or waitress happens to be, I say, could you bring me a glass of room temperature water? And I'm always baffled by the perplexed look that they have on their face, like, room temperature? I don't know how to create room temperature. So sometimes I have to formally educate them on, okay, you fill the glass up with, I don't know, 50% cold water. Don't put any ice in it, because that would defeat the purpose. I've had waitresses say, do you want ice in that room temperature water? And I'm like, no, because then it wouldn't be room temperature. So put cold water in there halfway, and then put the other half hot water, because they got lots of hot water at restaurants, because they make coffee and tea and other things, soup. And what that ends up doing is it causes the temperature of the water to be neutral. We want the water to be neutral, because if you're putting a neutral liquid into your body, then your body actually has the ability to absorb it. And that's what the purpose of drinking the water would be to begin with. Okay, so we want to make sure that we're able to absorb the water, which means that we want to drink room temperature water. Okay, so kidneys, we've got maintaining proper blood pressure. We got maintaining proper fluid levels. Okay, we talked a little bit about the electrolytes, the sodium and the potassium. There's also chlorides and other trace minerals that go into that. Okay, what's something else that's associated with the kidneys? Well, believe it or not, every one of your main senses, your vision, your hearing, your smell, your taste, and your touch, okay, they're associated with a major organ. So your hearing, believe it or not, is associated with the health of your kidneys. So people who get tinnitus, which is a ringing in the ears or a buzzing in the ears, okay, very, very annoying for those who have tinnitus. I'm going to tell you that that's telling you that you have kidney stress. You have kidney weakness. You need to support the health of your kidneys, which I can teach you how to do if you contact me, which we'll talk about at the end of the video. Okay? But if you have any kind of ringing in your ears, any kind of buzzing in your ears, any kind of difficulty with your hearing, you have a kidney stress. You have kidney weakness. You need to support the health of your kidneys. Okay? Now, the other thing that happens associated with the kidneys has to do with a thing called Meniere's syndrome. Has anybody ever had vertigo? Unbelievably unpleasant. I've experienced it one time, okay? I had a little crystal in my ear that affected the little hairs that help you to hear properly and help you evaluate sound. And when you get a little calcium deposit on those little hairs that are inside your ear, you're going to start to develop vertigo. Very, very, very uncomfortable. But suffice to say, I applied the appropriate solution for vertigo, and I only had to deal with the vertigo for less than probably about 3 hours. But I'll tell you what, worst experience, I wouldn't wish that upon my worst enemy. If you are somebody that suffers from vertigo, I would like to help you out with that as well. So we want to review what it is that we've learned so far. We've learned that the kidneys help with blood pressure. The kidneys help with overall fluid balance, which affects blood pressure. The kidneys help with a thing called tinnitus, or ringing or buzzing in your ears. And the kidneys help with Meniere's or what's known as vertigo. We want to make sure that you don't have any of those things. Now, if you do, there's good high-quality whole food supplements that you can take. There's homeopathic remedies that you can apply specifically for the health of your kidneys. Will also impact the health of your bladder, which we'll get to next month. But what we want to appreciate is that there's some things that you can naturally do. I'm a licensed chiropractor. As a licensed chiropractor, people say to me all the time, well, how do you influence the health of somebody's kidneys? Well, we check the kidney reflex. We make sure that anything that's affecting the kidneys is properly dealt with from a reset standpoint. We can look at foods that may be affecting the kidneys negatively, the liquids that we drink, the air that we breathe, the chemicals we come in contact with. All of these things have an ability to create an allergic response, which may create kidney problems. One thing about the kidneys that's important to know, according to the American Kidney Association, okay, they say that 65% of Americans are going to develop kidney failure in the course of their life. 65%. That's crazy. What are they doing for it? Nothing. They're prescribing medications which just accelerates your body's ability to have kidney failure. So at the end of the day, I would ask you probably not to listen primarily to what the Kidney Association has to say, simply because they want you on lifetime medications. If you'd like to regain the health of your kidneys, I would ask for you to give me a call. What is my phone number? It's area code 845-561-2225. Again, 845-561-2225. That is my cell phone. I will be the one answering the phone. So when you call the phone and I say, "Hi, doctor's office, this is Dr. Huntoon, how may I help you?" Please don't be surprised that I'm actually answering the phone, because as I learned from one of my mentors a long time ago, it is my phone, and if you're going to call it, I should be the one answering it. I want to give you the understanding that you need. I want to give you the information that you need. I want to give you back your power that you need in order to regulate your health. So call me and I can get a sense of what's going on with you, possibly invite you to come in for an evaluation. The evaluation this particular month, the month of January, is a kidney health evaluation. If you have kidney health issues, you can take advantage of the special that we run during the month of January, which is to come in and have a consultation with me. Okay, and we'll sit and we'll talk about, you have lab work, bring your lab work. We'll go over your lab work, whatever we need to do. I'll even do a brief kidney evaluation to determine what's going on with you. That's a $125 value. What does it cost you? Well, if you take advantage of the savings and the special offer, it costs you nothing. Now you'll say to me, because I've had people say this to me before, okay, when we're done with the consultation and I've evaluated what's wrong with you, if you'd like my help at that point, you're going to actually have to pay for it, okay? But in order to learn what's wrong with you and to get the specifics as to what you can do to help yourself, that's free, okay? So take advantage of that offer during the month of January, because come February 1st, kidney evaluation time is going to be over. So my phone number again is area code 845-561-2225. You can email me. Please don't text that phone, as it does not receive texts and I will never respond, and then you'll think that I'm ignoring you. Don't want to ignore you. I want to actually engage with you. That's why we do these videos. Email me. Same thing as texting, only through email. My email address is docrick, DOCRICK, at spineboy.com. Docrick at spineboy.com. Send me an email. Call me. Actually come to a free healthcare class held every evening, Tuesday evening at 6:30 at my office here in Pooler. That would be great. Whether I meet you face to face, whether I meet you over the phone, or whether I meet you through email, I would like to help you. Okay. So much of what goes on in our healthcare system right now is about just putting you on medication and taking your insurance card and going about the business of just taking money out of your account as much as they can, until they start to question, well, why are they taking the money out of the account? I had an interesting scenario this past week where a patient of mine, his health savings account, his money, his health savings account is actually regulated by the people who, quote, manage all the money that they take out of his paycheck in an effort to, I don't know, put it in the stock market and invest it in ways that they can make profit off of the money that he's actually pulling out. They would like to get very specific and very long, extensive explanation of why he's coming to see me. Now, here's the truth. I don't work for his health savings account. I don't even work for his insurance company. I work for him, my patient, okay? I'm happy to provide him with the information that they are asking him to provide. But at the end of the day, how he chooses to spend his health savings account money is nobody's business if it's a reputable, licensed healthcare facility. So I'll give him the information that he needs, but you as the viewer of this video, I want you to appreciate that your health insurance is yours. Okay? Your health savings account is definitely yours. Your flexible spending account is definitely yours. And don't let anybody try to get in the way with how you choose to spend your money, even if they don't want you to spend it getting healthy. They want you on medication. They want you on lifetime prescriptions. They want you having surgical interventions. And my suggestion to you is, if you stick with me throughout the course of this year and you watch these videos each week, which will be posted to the website, spineboy.com, my free healthcare class, this week's free healthcare class, there'll be a video associated with each topic. This video will be posted Wednesday morning after the class of Tuesday evening, but you can make it a habit of coming. But at the end of the day, I'd love to know who I'm trying to help out. So I want to thank you for tuning in this week. I'm going to ask you to tune back in next week, same health time, same health station. This is Dr. Richard Huntoon from Advanced Alternative Medicine Center, saying I look forward to supporting you as you move forward this year with your health, and thanks for tuning in.